As you guys can see here, I'm going to be using the ophthalmic and dermatologic agents review that I provided on your module. So instead of using the original outline, just to make it easier for me and for you guys, look at your ophthalmic and dermatologic agent review that can be found under module 13. And please let me know if you can't find it. So this is somewhat of a more concise version of your theory outlines. So let's talk about glaucoma. Glaucoma is a disease process that affects vision. So how does it happen? This happens because of an increased intraocular pressure. Because of that pressure, it can affect the optic nerve and it causes it to get smaller or atrophy, which causes peripheral visual field loss. So as you can see here on these pictures, this is what a person with glaucoma sees. So at the earlier stage, right, there's just kind of like blurring, darkening of the peripheral vision. And at a later or end stage glaucoma, this is what they see or basically cannot see. So as you can see, the peripheral vision, which is really the surrounding, gets affected. There's many different causes of glaucoma. So sometimes it can be congenital, sometimes trauma, and at times it is part of aging. It doesn't mean that everyone will develop it at one point, but the older you are, the higher risk you have of developing glaucoma. We have closed and open angle glaucoma. The main difference is basically the canal of Schlemm. So for closed angle glaucoma, it doesn't flow, right? So it's closed, and so usually that's a more acute case of glaucoma. The patient's vision deteriorates quite quickly, so because of that rapid or fast rise in intraocular pressure. On the other hand, we have the open-angle glaucoma. This is also known as a more chronic or chronic glaucoma because it's still open, right? So the canal of Schlemm is still open, so it allows for partial drainage of glaucoma. And sometimes the problem with glaucoma is the output, so the fluid doesn't have anywhere else to go, so because it's closed. But there are times that it is caused by a higher volume or increased production of fluid in the eyes, and we just can't keep up with the outflow. So again, the pathophysiology involved in glaucoma includes production of aqueous humor that's greater than the outflow, and there are times that it's caused by the retention of fluid, therefore increasing the volume, which results in increased intraocular pressure. So that increase in intraocular pressure then compresses the structure of the eyeball and also compresses the optic nerve, the vessels, the retina, but mainly the optic nerve, which then will affect the patient's vision. So there are terms that I want you guys to remember when it comes to the medications that we're administering and their effect. So you have mydriatic and miotic as well as cycloplegic. So mydriatic means dilate. It dilates the pupil. Miotic constricts the pupil, and cycloplegic will paralyze. So it paralyzes the ciliary muscle, which causes dilation. Mydriatic, the way to remember it, as you can see here, I've highlighted mydriatic. So it has an I here, and dilate has an I. As you can see, miotic, it has an O, and constrict will have an O. So hopefully this will help you remember it. And cycloplegic, I'm not sure if you guys ever had an eye exam, but they basically use a cycloplegic eye drop to help with the examination of your eye, sometimes when they're trying to look at the back of your eye or your retina. All right, the first agents that we are going to talk about that treats glaucoma are your cholinergic agents. So just remember, this is not necessarily new knowledge to you. Generally speaking, you now know what a cholinergic is and what are their side effects. So cholinergic agents, their mechanism of action, so it stimulates pupil constriction, right? That's not new. You guys have learned it not too long ago, right? Cholinergic agent will stimulate pupil constriction. It will dilate the blood vessels, and it will increase the aqueous humor drainage. The therapeutic effect of these drugs, well, the drugs that treat glaucoma in general, is decrease in intraocular pressure. So that's the main goal of this treatment. Indications, it's used for both open and closed angle glaucoma. It's also used for surgical procedures, and they're used to reverse mydriatics. Some precautions and contraindications, so this is general for all the other agents for glaucoma, any condition that the agent can aggravate or actions that can basically worsen the effect. Side effects that you guys have to remember, so common ones will be blurred vision, nearsightedness, and headache. But the systemic one, which you should have already learned, cholinergic, systemically can decrease heart rate and cause diaphoresis. So remember, cholinergic agents, their side effect include moisture or fluid coming out from different places. Nursing actions include assessing for therapeutic and side effects, as well as patient education regarding the drug, the dosing, the timing, and so forth. Examples of drugs under cholinergic agent include pilocar or pilocarpine or pilocarpine. Another drug class that you may be familiar with are your sympathomimetic agents. So sympathomimetic agents, they mimic epinephrine and norepinephrine. So they're adrenergic agonists. So these medications will stimulate alpha and beta receptor, causing mydriasis. And it also decreases aqueous humor production. Again, the therapeutic effect of glaucoma agents include decrease in intraocular pressure. Sympathomimetic agents are used for open-angle glaucoma as well as surgical procedures. Same precautions and contraindications as the other ones. And side effects. So side effects, burning, pain, and lacrimation. Systemic effects that you have to remember, right? So these are agonists. So if you look at the receptors that's stimulating, right? So you have alpha and beta receptors. So mainly though, systemic, you want to keep an eye on increased heart rate and dysrhythmias. Usually if it's a topical or local agent, it's rare that it affects the person systemically, but then there are instances that it can do that. So we still need to keep an eye on those possible side effects, right? Especially the systemic side effects, because they can be life-threatening, especially with the dysrhythmias and increased heart rate. Nursing action includes the same thing, assessing for therapeutic and side effects, patient education about dosing and timing, and examples of drugs under the sympathomimetic agents is alpha-GAN P or brimonidine. So alpha-GAN P or brimonidine is a sympathomimetic agent used for glaucoma. Next drugs are your beta-adrenergic blockers or beta blocker agents. So again, very similar to your systemic beta blockers, but this one is more localized, although we still need to keep an eye on the systemic effects. So mechanism of action include decrease in aqueous humor production. It can possibly increase the outflow, therefore relieving that intraocular pressure. And its therapeutic effect, generally speaking, is to decrease intraocular pressure. Indications for these agents are open and closed angle glaucoma, and precautions and contraindications are basically the same. So we need to keep an eye on possible beta adrenergic blocking, which may be harmful for certain patients. So let's say we know that a beta blocker can decrease the heart rate and you have a patient with bradycardia. We need to keep an eye on that. That may not be the right agent for that patient. Anyhow, so side effects. Localized pain, blurred vision, inflammation, so those are the local side effects. And systemic side effects that we want to keep an eye on is decreased heart rate or bradycardia and bronchoconstriction. So if you have a patient with COPD and they are receiving this medication and you notice a worsening of their respiratory status, we may need to evaluate the drugs or the medications that they are on, because we know that beta blockers can cause bronchoconstriction. So nursing actions, remember to always assess for the side effects, the therapeutic effects, and also patient education regarding the drug, the dosage, the diagnosis, and so on. Examples of drugs under this class, you have your selective, which is your betaxolol. So this is the most potent of these two drugs that you have to remember. And you also have the non-selective, which is your timolol. So as you notice, they end in olol. So that to you is a clue that these are beta blockers. So again, the most potent of these two is your betaxolol. Alright, another very familiar classification or pharmacologic class of medication is your carbonic anhydrase inhibitor. So carbonic anhydrase inhibitor, we've learned it, I believe, in Unit 3. Anyway, so for this specific purpose, right, for glaucoma, the mechanism of action is the decrease in production of aqueous humor. So just remember though, systemically, how the carbonic anhydrase work is by excreting sodium, water, and bicarbonate. So knowing that it will get rid of that extra bicarbs. So we are possibly risking acidity if we give too much of this drug. The therapeutic effect for this drug is decrease in intraocular pressure, and indications include open and closed angle glaucoma. Same precautions and contraindications, which are the conditions that are aggravated by the agents and certain actions. Now, side effects. So locally, it can cause blurred vision. However, systemically, knowing that carbonic anhydrase inhibitors can affect your fluids, electrolytes, and your pH balance, then we know that side effects can be acid-base influence, right? Acid-base imbalance, as well as electrolyte imbalance. Probably dehydration too, especially if we're giving the systemic version of this drug. Nursing actions include assessing for therapeutic and side effects, and patient education include educating the patient about the dosing, timing, and all the other extra information that they need to know when they are using these medications. Examples of drugs under carbonic anhydrase inhibitor agents include dorzolamide and acetazolamide. So the one that you previously learned is acetazolamide, and just know that acetazolamide can be given PO and intravenously. Prostaglandin agonist agents, their mechanism of action is increase of aqueous humor outflow. The therapeutic effect is to decrease intraocular pressure. The indication for this drug is open angle glaucoma. If this drug works by increasing the aqueous humor outflow, right, you have to have open angle glaucoma, because if it's close angle, even if it's trying to increase that outflow, there's really no way out if it is closed. Precautions and contraindications. So same as the other one, any condition that can be worsened by these agents, then we need to keep an eye on and possibly avoid this drug or the other agents. Physical contact with other eye drops can cause precipitation, so we need to make sure when we're storing it, make sure we're storing it correctly and that the bottle is sealed when we're storing it. Side effects include burning, stinging, and bloodshot eyes. A side effect that you have to really remember and also educate your patient about is the possibility of permanent eye color change, especially those light, beautiful light colored eyes, so hazel, green, blue. So it will turn their eye color to brown. So just make sure that you take that in consideration, and it should be something that you have to talk to your patients about, especially if they have those eye colors that I mentioned. Nursing actions include, again, assessing for therapeutic effects and side effects, patient education, so include the dosing, the timing, what it is for, and so on, but also, again, reminding them that these eye drops can change their eye color. Example of drugs under this class is latanoprost or Zalatan.